If you're over 60, this message could save your life. Right now, millions of seniors are taking vitamins they believe are protecting their health, but these same supplements could be quietly setting them up for a stroke by morning. Your daily pill routine might be more dangerous than you think. Please watch this entire video, as it will help you and your loved ones live longer and avoid a medical emergency that strikes without warning. Hello everyone, I'm Dr. Edward Harris. With over 3 decades of dedication to the medical field as a geriatrician, I've witnessed firsthand how the golden years can turn into the most vulnerable time of life. After more than 30 years of practicing medicine with unwavering passion, I've seen too many seniors suffer preventable strokes, not because of accidents or chronic disease, but because of something they thought was helping them. Vitamins. Every day, millions of Americans over 60 reach for their morning supplements, believing they're protecting their heart, boosting their energy, or sharpening their memory. But what if I told you that certain common vitamins, especially in high doses or taken at the wrong times, can quietly raise your stroke risk overnight? What seems healthy might be harming your brain in silence. Today, we're going to examine 6 specific vitamins that could increase your risk of brain bleeds, blood clots, or sudden blood pressure spikes. The early morning hours are when your brain is most vulnerable, and these supplements could be the trigger that changes everything. If you find these elderly healthcare tips helpful, drop a 1 in the comments to let me know you're with me. I will read all the comments and respond in the most detailed manner as a doctor. Vitamin number 1, vitamin D. You've been told vitamin D is essential for bone health, mood regulation, and overall vitality as you age. That's absolutely true, but it's only part of the story. Too much vitamin D or taking it at the wrong time can lead your brain into dangerous territory. Let me share the story of Mr. Thomas, a 74-year-old retired Navy veteran from Texas. Thomas believed in the more is better philosophy when it came to his health. He was taking a high-dose vitamin D supplement, 10,000 IU daily, convinced that stronger doses would give him stronger bones and better health. One morning, Thomas's wife found him confused and unable to speak clearly. His right arm showed weakness, and he couldn't maintain his balance. The family rushed him to the emergency room, where doctors discovered he had suffered a silent overnight stroke. His lab results revealed dangerously high calcium levels in his blood-stiff arteries and erratic blood pressure patterns. Here's what happens when you take high-dose vitamin D without medical guidance. Your body begins depositing excess calcium into your bloodstream, and over time this calcium builds up in your blood vessels, making them stiff and narrow. When your arteries become inflexible, blood clots can form more easily and travel to your brain. As we age, our arteries are already becoming less flexible naturally. When you add the calcium overload from excessive vitamin D, plus common factors like dehydration and poor sleep quality, you create the perfect storm for a stroke. The most dangerous part. There are often no warning signs. You go to bed feeling fine and wake up with stroke symptoms. Many over-the-counter vitamin D supplements contain 5,000 to 10,000 IU daily. Research published in the Journal of the American Medical Association shows that even 2,000 IU daily can be too much for older adults who aren't actually deficient in vitamin D. Yet millions of seniors are taking these megadoses without ever having their blood levels checked. The cost of this mistake isn't just money, it's your independence, your ability to speak clearly, your capacity to hold your grandchildren, and potentially your life. If you're taking vitamin D supplements, have your blood levels checked regularly by your doctor. The optimal range for seniors is 30-50 mg/ml, not higher. Always take vitamin D in the morning, not at night, as this aligns better with your body's natural rhythms. Never self-prescribe high doses, and be especially careful if you're also taking calcium supplements or heart medications. Don't worry too much if you've been taking high doses, but do take action. Schedule an appointment with your doctor to discuss your current regimen and get your levels tested. If that surprised you, wait until you hear about combining your morning pills with another healthy vitamin that most people don't think twice about. Vitamin number 2, vitamin E. Most seniors take vitamin E thinking it's beneficial for heart health, skin vitality, and immune system support. In appropriate doses, it can indeed help. But for those over 65, vitamin E can quietly become one of the most dangerous supplements in your medicine cabinet, especially if you're taking blood thinners or managing high blood pressure. Let me tell you about Mrs. Eleanor James, an 81-year-old retired librarian from Ohio. Eleanor was sharp as a tack, always reading and staying mentally active. She was taking warfarin for a heart valve issue, and her condition was well controlled under medical supervision. Without consulting her doctor, Eleanor added a vitamin E capsule to her daily routine, 800 IU daily. Her reasoning was simple. I just wanted to help my memory and circulation. 3 weeks later, Eleanor's family rushed her to the emergency room with confusion, severe headache, and vomiting. The brain scan revealed a hemorrhagic stroke, meaning her brain was bleeding. Here's the scientific reality. Vitamin E acts as a natural anticoagulant, meaning it thins your blood. When combined with medications like aspirin, Plavix aliquis, or warfarin, it can push your blood's clotting ability over the edge. Your aging blood vessels become more fragile with each passing year, and one tiny rupture can change your life forever. Brain bleeds don't just affect memory, they rob you of your ability to speak, walk, and live independently. They often happen with no warning striking while you sleep or during routine daily activities. Many vitamin E supplements contain far more than what seniors need. The recommended daily intake for adults is just 15 milligrams, which equals about 22 IU. Yet most supplements contain 200 to 1,000 IU. If you're over 65 and taking blood thinners, you're essentially gambling with your brain every time you take these high-dose supplements. Mrs. James survived her stroke, but she now uses a walker and struggles with short-term memory. As she told me during a follow-up visit, I just wanted to help myself. I didn't know I was doing harm. Not every vitamin is safe just because it's available over the counter. If you're taking any medication that affects your heart or blood, you must talk to your doctor before adding supplements to your routine. This isn't about being overly cautious, it's about being smart and protecting the brain that served you so well for so many years. Vitamin number 3, vitamin B6. If you're over 60, you've probably heard that vitamin B6 helps with energy production, nerve health, and memory function. While B6 is indeed essential for these functions, too much of it can cause irreversible nerve damage, especially in older adults whose bodies process supplements differently than younger people. Consider the case of Mr. Harold Carter, a 76-year-old retired truck driver from Kansas. Harold started experiencing numbness in his feet and trouble with balance. He described strange pins and needle sensations in his hands that seemed to worsen over time. Harold began falling first once while getting out of bed, then again in the bathroom. His third fall resulted in a head injury and mild concussion. When we investigated his supplement routine, we discovered he'd been taking a high-dose nerve support vitamin for over a year. The label claimed it supported circulation and brain function, but it contained 100 milligrams of vitamin B6 per tablet, over 6 times the recommended daily allowance. Harold was taking 2 tablets daily, convinced he was helping his nervous system. Chronic B6 toxicity occurs when the vitamin accumulates in your nervous system faster than your body can process it. Unlike water-soluble vitamins that flush out in your urine, excess B6 actually damages the protective sheath around your nerves. Think of it like stripping the insulation from an electrical wire. The results are devastating. Numbness muscle, weakness tremors, loss of coordination and memory issues. The nerve damage can become permanent if caught too late. These symptoms are often confused with normal aging arthritis or early signs of dementia, which means many seniors are walking around with a silent, preventable neurotoxic condition. Many brain vitamins sold in stores contain megadoses that far exceed what your body needs or can safely process. The safe daily limit for seniors is just 2 to 10 milligrams, yet these supplements often contain 50, 100, or even 200 milligrams per dose. The long-term cost isn't just the price of the supplement, it's the falls, broken bones, traumatic brain injuries, and loss of independence that follow when your nervous system becomes damaged. Harold was fortunate that we caught his condition early enough to stop the progression, but his balance never fully recovered. He now uses a cane and has limited his driving. As he reflected, I thought I was protecting my brain. I didn't realize I was poisoning it. Older adults should never take high doses of vitamin B6 without medical supervision. If you're taking any supplement that contains more than 10 milligrams of B6, it's time to have a serious conversation with your healthcare provider. Are you watching and finding these health tips for seniors useful? Comment 2 below to show your support. I will read all the comments and respond in the most detailed manner as a doctor. Vitamin number 4. Vitamin A. Vitamin A sounds innocent and essential, and it is when taken appropriately. It's crucial for eyesight, immune health, and skin maintenance. But too much vitamin A can quietly accumulate in your body, increasing pressure inside your skull and leading to a brain emergency that mimics stroke symptoms. Let me share the story of Miss Lillian Moore, a 79-year-old retired piano teacher from Oregon. For weeks, Lillian experienced worsening headaches, blurred vision, and dizziness. Her family initially worried it might be the onset of dementia, but when she started slurring her words and struggling with balance, they feared she was having a stroke. The MRI showed no blood clot or brain bleed, but it revealed elevated intracranial pressure. Her spinal fluid was backed up, and the tiny veins in her brain were under extreme stress. The cause: a daily vitamin A supplement marketed for skin and eye health that she'd been taking for over 5 years. The supplement contained nearly 10,000 IU per day, far more than her body could safely process. Vitamin A is fat-soluble, which means it doesn't leave your body quickly, like vitamin C or B vitamins do. Instead, it accumulates in your liver tissues and over time in your brain. Seniors are especially vulnerable because liver function naturally slows with age, making it harder to process and eliminate excess vitamin A. Many people don't realize their daily multivitamin already includes a full day's dose of vitamin A. When they add a separate vitamin A supplement, they're unknowingly creating a dangerous accumulation that can lead to pseudotumor cerebri, a condition where pressure builds inside the skull as if there were a brain tumor, even though there isn't one. The symptoms of vitamin A toxicity mimic those of a stroke: severe headaches, blurred or double vision, nausea, dizziness, and confusion. In severe cases, it can cause permanent vision loss or cognitive decline. The tragedy is that these symptoms develop gradually. So many seniors and their families attribute them to normal aging rather than supplement toxicity. The safe upper limit for older adults is around 2,500 IU daily, and only when truly needed. Anything above this amount should be carefully monitored by a doctor who can track your blood levels and watch for early warning signs. She's still recovering her balance months later, and her independence and confidence have been shaken. As she described it, "The fear that comes when your brain and body betray you is unlike anything I've ever experienced." Before reaching for any anti-aging or vision support pills, ask yourself, do you know exactly what's in it? Do you really need it? Is your brain quietly paying the price for what you think is helping you? Don't let fear overwhelm you, but do let awareness guide your choices. Knowledge is your best protection against these hidden dangers. Vitamin number 5, niacin. Niacin, also known as vitamin B3, is often praised as a natural way to lower cholesterol. You'll find it in heart health supplements, fortified cereals, and sometimes it's even prescribed by doctors. But in high doses, niacin can provoke sudden blood pressure changes, stress your heart, and constrict the blood vessels in your brain. Let me tell you about Mr. Dennis Alvarez, an 82-year-old retired postman from Florida. Dennis complained of intense facial flushing, pounding chest sensations, and waves of dizziness each morning. His wife thought it might be anxiety, and his son suspected a reaction to his blood pressure medication. It turned out Dennis was taking a heart-healthy supplement he'd bought online. The label promised benefits for cholesterol and circulation, but it contained 1,000 milligrams of niacin per serving, and Dennis was taking it twice daily. That's more than 60 times the recommended daily amount for seniors. Here's what niacin does to your blood vessels. It causes them to dilate rapidly, which is why Dennis experienced the facial flushing. But then your vessels rebound and constrict, which raises your blood pressure and strains your aging heart. This on-again, off-again pressure pattern is like taking a hammer to fragile glass. The constriction phase reduces blood flow to critical areas of your brain, creating the perfect conditions for a stroke. Dennis experienced what we call a transient ischemic attack, or TIA, a mini-stroke where his speech slurred for about 2 minutes before returning to normal. High-dose niacin can trigger atrial fibrillation, increase insulin resistance, and constrict cerebral arteries, especially in people over 65 who already have high blood pressure. The frightening part is that you don't need a prescription to buy these dangerous doses, and many seniors are unknowingly taking megadose supplements. The consequences include strokes, heart rhythm problems, and sudden falls from dizziness. These aren't theoretical risks, they're real dangers that I see in my practice regularly. Dennis is recovering well. He's no longer taking niacin, and he's being closely monitored. Fortunately, there was no permanent damage, but as he told me, I just wanted to live longer. I didn't know I was gambling with my brain. If you're taking any supplement for heart health, read the label carefully. Look for terms like flush-free niacin, time-release niacin, or any niacin content over 50 milligrams. If you find any of these, talk to your doctor before continuing. Remember, protecting your heart shouldn't come at the expense of your brain. There are safer, more effective ways to support cardiovascular health that don't put you at risk for stroke. Vitamin number 6. Iron. Iron supplements are commonly taken by seniors who feel tired or have been told they're anemic. While iron deficiency is a real concern, too much iron can be just as dangerous, especially for older adults whose bodies don't regulate iron absorption as effectively as they once did. Let me share the story of Mrs. Dorothy Walsh, a 78-year-old retired nurse from Michigan. Dorothy had been feeling tired and assumed she needed iron supplements. She started taking a high-potency iron supplement, 65 milligrams daily, thinking it would restore her energy and vitality. Over several months, Dorothy developed concerning symptoms: irregular heartbeat, shortness of breath, and episodes of confusion. Her family noticed her skin had taken on a grayish tint, and she complained of severe abdominal pain. When we ran blood tests, we discovered iron overload, a condition where excess iron accumulates in vital organs. Unlike many nutrients that your body can easily eliminate, iron accumulates in your organs when taken in excess. Your heart, liver, pancreas, and brain become repositories for this excess iron, and over time, the iron begins to generate harmful free radicals that damage cellular structures. In the brain, iron accumulation can contribute to cognitive decline, increase the risk of stroke, and accelerate the aging process of brain cells. The iron acts like rust, forming inside your most vital organs, slowly degrading their function. Many seniors don't realize how much iron they're getting from multiple sources. Their multivitamin might contain iron, their breakfast cereal is fortified with iron, and then they add an iron supplement on top. This creates a dangerous accumulation that builds up over months and years. The recommended daily allowance for iron decreases as we age. Men over 50 need only 8 milligrams daily, and women over 50 need the same amount. Yet many supplements contain 18 to 65 milligrams per dose. Excess iron doesn't just affect your brain, it also damages your cardiovascular system. Iron overload can cause cardiomyopathy, a condition where your heart muscle becomes enlarged and weakened. This increases your risk of heart failure and can create conditions that lead to blood clots and stroke. Dorothy's case required immediate intervention. We had to stop all iron supplements and begin a treatment called chelation therapy to remove excess iron from her body. The process took months, and while she recovered, some of the damage to her heart was permanent. Before taking iron supplements, you need blood tests to determine if you're actually deficient. Many cases of fatigue in seniors are not caused by iron deficiency, but by other factors like sleep disorders, medication and side effects, or underlying health conditions. As Dorothy reflected, I thought I was fighting fatigue, but I was actually creating a much bigger problem. I wish I had known to get tested first. If this video on elderly care is valuable to you, leave a 3 in the comments to let me know you're here. I will read all the comments and respond in the most detailed manner as a doctor. Let me share the transformation story of Mrs. Carol Jennings, a 73-year-old retired school principal from Arizona. Carol had a drawer full of supplements: a multivitamin, high-dose B vitamins, vitamin D, niacin, and vitamin E. She told me, "I'm doing everything right, doc," but her blood pressure was climbing, she experienced dizzy mornings, and her balance was becoming unreliable. Carol's new breakfast routine was simple but powerful: 1 boiled egg for high-quality protein and choline for brain health, half an avocado on whole grain toast for healthy fats and fiber, a handful of fresh blueberries for antioxidants, a glass of room temperature water for hydration, and sometimes a small portion of walnuts for additional omega-3 fatty acids. No processed foods, no vitamin-packed cereals, no handful of pills. Just real food with natural nutrients that her body could understand and absorb efficiently. Within just a few weeks, Carol's dizziness faded, her blood pressure readings improved, her energy levels returned, and her mind felt clearer than it had in years. What changed wasn't the quantity of nutrients she was getting, but the quality and the way her body could process them. I want to hear from you. Share one specific thing you've learned today that you plan to apply in your own life. Maybe it's scheduling a blood test to check your vitamin levels, or clearing out supplements you're not sure about, or simply committing to read labels more carefully. Your experience and wisdom matter to this community. Other seniors are facing the same questions and concerns you have, and your insights could help them make better choices. If you found this video helpful and want to see more content like this, please subscribe to our channel and turn on notifications. Share this video with family members or friends who might benefit from this information. Sometimes the most loving thing we can do is share knowledge that could protect someone we care about. Let our community know where you're watching this video from. Share your city and state in the comments section. It's amazing to see how far this health information travels and how many people are committed to aging with wisdom and awareness. Remember, the goal isn't to live in fear of every supplement or to avoid all forms of nutritional support. The goal is to live with awareness, to make informed choices, and to work with healthcare providers who understand your unique needs as a senior.